Thank you. Will speaker number 12 step up to the podium and introduce yourself? Please state your name and any organization you are representing for the record.
My name is Anne Fuqua. I don't have any financial relationships or conflicts of interest. First, I want to thank the FDA, speakers, and committee members for the effort and thoughtful deliberation you have given to this issue of higher dose opioids. I was impressed and relieved by the emphasis speakers placed on weighing risk and benefit for each individual. High dose patients like me exist in a precarious state. We want to live our lives to the fullest, yet many of us say we feel we live in a holding pattern due to uncertainty about whether we will be able to continue treatment that is effective for us as individuals. I would love to go back to school. I don't want to be on SSD the rest of my days. I realize it wouldn't be smart to start school only to find out a few months later I'm unable to finish because my doctor is no longer able to continue to prescribe the medication that allows me to be a functional human being. I'm on approximately 1,000 MME. I have been stable for over 10 years with no side effects. I don't have endocrinopathy or sleep apnea. I have a life I'm incredibly grateful for. I live independently, and I'm able to do things I never dreamed would be possible when my body was ruled by spasms that made it nearly impossible to sit in a standard manual wheelchair like this. I know the likelihood of finding someone who will be willing to take me on as a patient if I had to change doctors would be almost non-existent. I'm not willing to become a prisoner of my own body again. I don't want to die, but that's not living. We need a safe harbor provision that would allow physicians to take over the care of a patient like myself or titrate a new patient who's failed other measures without fearing for their license or freedom. Having a chronic illness is difficult as it is. Patients shouldn't have to wonder if each month is the last they'll be able to continue a successful regimen. Even when medications are prescribed by a respected physician, this does not guarantee that the patient will be able to fill their medication. In some instances, wholesalers are usurping the prescriber's judgment and restricting the number of dosage units a pharmacist can dispense to any patient in a single month. This would create a big problem with the smaller dosage units taking more pills. This arbitrary figure is not based on patient-specific factors. Rather, it applies to all patients of a given pharmacy. So far, this seems to occur mainly in California. The recent clarification of the CDC guidelines, the pain management best practices approved by HHS, and the statements at this meeting are incredibly important. Prescribers are wary. Many patients say their doctors stated they want assurances they will not be prosecuted or sanctioned by their licensing board if they prescribe in accordance with these measures. We desperately need to translate this to patient care. Change is coming, but for patients who are exhausted from 3 years or more of tapering, uncontrolled pain, and inability to sleep, change can't come soon enough. 5 years ago, I would find out about a suicide every couple of months. Now, names get added on a near daily basis. Many times, several are added in a single day. The 280 suicides Dr. Darnell cited yesterday is now close to 300. Some of those deaths are recent. Others are older, but reported by friends or family only recently. No one should suffer from pain that's so severe, ending their life becomes a viable choice, especially if medication has already proven effective for improving their symptoms. Thank you.
Thank you.